Hello, in this video, I'm recording a case study of a family of three that wanted to evaluate if they should stay on, in this case, marketplace plans or consider going over to a private plan option. So in this case, this family, they are high earners, so they do not get a subsidy. Average income is above $600,000, so they are not eligible for any subsidy. So they are paying full price for marketplace coverage. And the reason why they preferred marketplace coverage is because they were able to find coverage where their physicians, their preferred physicians, were in network. And honestly, if you do have health concerns, marketplace coverage, because it does not deny based on any pre-existing conditions, it is the best option for that. So if you have health concerns or something like that, marketplace, of course, is no questions asked. But in this case, they wanted to explore what other options were available. And so what we looked at is that the wife has had some health concerns, and then the spouse also has some premature diagnoses, in the sense that some things that are typically common around age 50 or 60, think like high cholesterol, high blood pressure, they've gotten it earlier, closer to their late 30s, early 40s. So that definitely causes some pause. But that being said, when we're looking at health plans, the main things that we're looking at are obviously the carrier, because that's going to determine our networks. But particularly, we want to know what our premium is. Obviously, everyone wants to know what they need to pay monthly. Also, what the deductible, their maximum out of pocket, and then if there are any copays. So because this particular family has a high income, and for anyone who earns honestly over $60,000 a year, a health savings account, an HSA, is honestly the most tax advantaged account that anyone can have. It is a triple tax advantaged account, so I'll just have a really quick aside here. It's a triple tax advantaged account. So if you have access to a health savings account, you're able to contribute to the account tax free. Any funds that are in the account then grow tax free, and then you take the money out on a tax free basis as long as it's used for health related expenses. Until you hit full retirement age, then you can take the money out for any reason whatsoever. So it is a sleeper in terms of the qualified account game. I don't think most people really understand how powerful a health savings account really is. It's not so much about how much you can contribute. It's about the vehicle and how your money can grow tax free and then eventually being able to be taken out tax free. That's honestly a game changer. And in order to access a health savings account, you need to have a health savings account compliant health plan. And those are what's known as high deductible health plans. So HDHP, high deductible health plan. And that's exactly what this conversation that I was having with this family is about. They can stay on their current plans that are not health savings account compliant, or in this case, and the reason why they did not have that option is because in their particular zip code, for the providers that they wanted, there were no plans that were HSA compliant that their providers accepted. So Marketplace is not an option for them for an HSA option. So with that in mind, there's a new plan for entrepreneurs specifically that came out on the market this in recent years, and I'm recording this at the end of 2025. And so in 2025, a new plan came out that is a national PPO, which is what everybody wants. It is on the Blue Cross Blue Shield network, and it is the network out of Nebraska. Okay, so even though it's Blue Cross Blue Shield, Anthem, they operate as a series of individual state-specific organizations, even though they have a national brand, which is called Anthem, Anthem Blue Cross. All right. So I'll just walk through this case study so you get an idea of what we were considering in items such as that. So currently, they have a total monthly premium of $988.40. Again, not eligible for any subsidy. The husband and wife were on a Blue Cross plan, and this was their premium. And the child was on a local regional plan. So this is Community Health Choice. This is a carrier out of Texas. They're really prevalent in the southern part of Texas. Okay. And so their monthly premium total was $988, so just under $1,000 per month. You'll notice that they chose to go on gold plans. So in the marketplace, there's bronze, silver, and gold. Effectively, the higher premium you pay, the lower your deductible, sometimes the lower your maximum out of pocket. But certainly once you hit your deductible, that's where your share of expenses goes down significantly until you hit the maximum out of pocket. At that point, the the client, the person who has the health insurance, does not pay anything else. The plan now pays 100%, which is wonderful. So typically people hit their maximum out of pockets when they have a childbirth, a heart attack, stroke, one of those major events. That's when most people hit their max out of pocket, also known as your MOOP. So you'll notice these were the plans that they were on for current year. We were discussing renewing those plans for the year ahead, and there was a price increase on the exact same plans. So overall, about a little bit over a $420 increase monthly, so from $988 to $1,401. No changes in the plans, exact same plans. So you'll see they have the same co-payments for their primary care. So if they were to go to their normal doctor, $30 for themselves, $15 for the child. If they needed to go to a specialist like a dermatologist or a chiropractor, for the parents it would be $60, for the child it would be $30, and then for prescription drugs, for the parents $15, for generics, and for the child $10. Okay. Other thing to note, the deductibles did go up to $2,000 each, and the max out of pockets went out as well. So again, the deductible is the first level of defense. So assuming you have a health event that does not have a fixed copay. So let's say they needed to go to the emergency room or to urgent care. Okay, then this family would pay, or any family would pay 100% of those costs until they hit their deductible. Once you hit your deductible, now you start having a cost share with the health plan until you hit the max out of pocket. At that point, you pay nothing more as the person enrolled in the plan. So that's how the health insurance plans work. Okay. So the max out of pockets did increase on the parents, but not on the child. So this was essentially the base case. Base case, renew your existing plans, okay, for 1401. Now, we were again considering them moving over to private plans. So on the private plan, we were considering the wife did have preferences to stay on Marketplace for her own reasons. And so we did want to separate them out. So what if the wife stayed on the current Blue Cross plan and the husband and child went over to this private plan, and then also ran the numbers on if the entire family went over to the private plan. So we do have the option to carve out families. As you can see on Marketplace, just because you're all one family, you don't all have to enroll in that one plan. So even in previous years, I was able to separate them out into two separate plans for that one family. So two separate plans, two separate carriers, so forth and so on. So on this one, same thing. So assuming the wife stays on the current plan, then her premium alone is $541.95. Now, if we move the husband and child over to that private plan, they are still on the Blue Cross network, and all of their providers are in network on this plan. But what this allows them to do is now participate in a health savings account. Now, a health savings account, I've already talked about the reasons why you would like that. I'm just here on Fidelity's website just to look at the limits for the next year. So 2025, for an individual person, the contribution limit is $4,300. For a family, it's $8,550. For calendar year 2026, we're looking at $4,400, so it increases by $100 for an individual, and $8,750 for a family. And if you're over age 55, you can contribute an additional $1,000. Now, again, these numbers are not amazing. Like, you can't put away 50 grand, but it's not really about that. It's about those small wins. So if I can put away $8,750 every single year, after 10 years, I have 87 grand in there. And of course, these limits increase every year. So you're going to have at least 80 grand in there. Now you have some real money that we can talk about doing some things. And from an equities standpoint, I don't want to get too far outside of the scope of this particular video. But again, having a health savings account just opens up so many options from the equities market to being able to do self-directed accounts, which opens up real estate, gold, XYZ, right? But it's just a vehicle. Now, the main caveats of this private plan are that you'll notice here on the Marketplace plans, They're what we call fixed copays. So even on day one coverage, so even if these are effective January 1st, right? Most marketplace plans are effective January 1st. So January 2nd, they go to the doctor. They have not hit their deductible. If either of the spouses, either of the parents goes to the physician, they will have a $30 copay. So even though they have not hit their deductible, it will only cost them $30 to see the doctor. On the private plans, it doesn't work that way. They have to hit their deductible, and then they will have a 30% coinsurance. So what does that mean? In addition to their monthly premium, the deductible, again, high deductible health plan, the deductible is higher. It's $5,000. So until, in this case, the husband and child, until either of them hits their $5,000 deductible, they're paying 100% of the cost. So in this case, to see their physician, they're before the deductible, they're paying 100%. Once they hit their deductible, then they're paying a 30% coinsurance. So that means whatever if the physician costs $100, then that client pays $30 to see that physician. They're paying 30% of those costs. And that counts for primary care, specialty, so in specialty chiropractor, dermatologist, rheumatologist, any of the ologists, or if you need any generic prescription drugs. Okay. And so this is certainly going on a private plan is great. It has tons of options. But the real reason by going on this plan is not necessarily to save money, because as you see here, it will be another $200. But candidly, at their income level, $200 a month is inconsequential. That's negligible. That's not really a big mover here or there. But the real needle mover here is having access to a national network. So if you travel a lot, if you're not necessarily sedentary in one location, that's huge. Marketplace plans are restricted in their network, and it's typically where you live. So if you live in Oklahoma and you're going on vacation in Arizona, outside of an emergency, you will not be able to find a provider that accepts your plan because you're out of network. On a national PPO, that's not something you have to worry about. You can basically go to anybody that you want, and it's just a matter of how much you pay. You either pay the in-network rates or the out-of-network rates. So it gives a ton of flexibility. So I will pause there. If you're interested in exploring what your options are on either a private plan, marketplace, or a combination, something like I've shown here, I'll have a link in the description where you can book a time to set up a time to chat about your specific situation. But again, this plan here that I'm covering, this is specifically for business owners. If you have a day job or you have a W-2 income where you are offered group coverage, in majority of cases, you will have to accept that group coverage because that is going to be the most cost-effective coverage available. Unless we're talking about is only affordable for the employee, but not their spouse and children. That's a different conversation. But this is particularly for entrepreneurs, for business owners that are trying to find a solution for their family, and they want to know what else is out there besides Marketplace. This is one of the strongest answers available. All right. Thanks so much. Have a great day.